Okay, so we're going to look at how we would document a transplant in the operating theatre. So this task would be completed by the surgical consultant or registrar who is undertaking the transplant operation. When we're in the patient record, we go to specialty view and into the transplant specialty view. And for all of our patients, we should be able to see that there's already an open referral for this patient. So under the Transplant Status Management tab here, we can see that there's an open referral and a patient who's been approved for listing. The first thing we need to do, so there are 3 tasks here. The first task is to close the referral, which at the time of transplant is now complete. So if we click the Edit Referral button and change the status to transplanted, the green tick at the top left hand side saves that, and then when we refresh our view, you should be able to see that the referral now shows as inactive and has been closed because the patient's been transplanted. So the second task is to complete the transplant record power form. So this form documents all of the basic information about a transplant that we need for reporting to an HSBT and to use to later on populate the operation note as well. So to do that, you'll see a section in the transplant specialty view that's called transplant record. We just click on new record. And when you click the new record button, a power form pops up. You'll see on this form there are a number of tabs on the left hand side here. Okay, the top 3 are always active. The individual organ tabs will activate depending on what type of transplant you select. So when we're filling this form out, so transplant date, if it's today, if you just press the T button, it'll always put today's date in. Also, we're putting a deceased donor transplant in here. So we do have other transplant hospitals here to allow us to document transplants that have been completed elsewhere historically, if we feel that's useful. So you can go back and put in just some basic information about previous transplants so they appear in the patient's record. Consultant's name. So in theatre, we'll always check blood group compatibility, cross-match results, and cross-match. If it's an AIT transplant, then we can document the type here. So once the first tab's completed, we move on to the second tab. In here, we put in the NHSBT donor number. Now this is really important because the NHSBT donor number is what's used to match the data coming in from the tissue typing database, which will later on show us the HLA mismatches and so on and DSAs for this transplant. So please double check that that's correct. Hospital code. Transplant type. If it's a living donor, so if on the first page we've identified this as a living donor transplant, then these boxes will be grayed out and you'll be asked to enter the living donor MRN in here. Again, the living donor MRN is very important because that's what will link the donor and recipient records together to identify again the tissue typing data in terms of HLA mismatch and DSAs and so on. Fill the rest of the bits out. Most of this can be found on TOM or the EOS form as you get it. So all of this information should be available to you at the time of transplant. Okay, timings. Very, very important that we put the timings in because that allows us to automatically calculate things like anastomosis time and cold ischemic time. So donor cold perfusion time will always come from the HDA-A form that comes with the organs. So we fill that out on this page. Again, virology will all be present, EBV and CMV here for the donor. EBV and CMV for the recipient, I'll show you later, will automatically be pulled from the patient's flow sheet, so we don't have to enter those manually. If on the EOS form there's any donor infections or donor contraindications indicated, we can put those in here just so we've got a record of them. And then subsequently we can come back into this form and enter the perfusate culture and the organisms if they're positive. So leave that blank at the time of transplant, and that can come back in and be updated later. Once the donor information is added, we then select the organs we transplant. Okay, so for a kidney pancreas transplant, you select both kidney and pancreas or individual organs every time you select an organ, a form will pop up for you to enter information about that organ, and then you can come back to this tab and add additional organs as required. So if this was a kidney transplant, we can pop up the kidney form, and you'll see you've got the data that we're all familiar with in terms of number of arteries, ureters, perfusion, damage, and so on. This has been designed to keep the amount of data we have to enter to a minimum, but just capture just enough to fill out the NHSBT forms. If you're using machine preservation, you can enter the resistance and flow rate in here, Soltran batch numbers, and expiry date. I think the expiry date doesn't actually have a day on it, but the date format is always a full date format, so just enter the first of whatever the month is in there. Anastomosis, reperfusion, JJ stent. We'll come back to stent insertions later on, because there will be a way of actually documenting the stent registry in EPR moving forwards. And then your timing. So these should be in the correct order. So clamps on, kidney out of ice. And as we add these timings in, so clamps come off, and you'll see that because we've already entered the initial perfusion time with the donor hospital, this automatically then calculates the anastomosis time and the cold ischemic time for us here. If we were doing a dual kidney transplant, we'd select yes here, and that would then pop up a second form for the second kidney where you can enter the timings for the second kidney. In this case, we'll just put a single kidney in. The graft failure section is for documenting when this graft fails subsequently, so we'll leave that blank at the time of operation, but you can come back into this record form to document the reason for failure and the date of failure when a graft fails eventually, and that will close the transplant record. Once complete, click the little backward arrow at the top left-hand side, and that brings us back. If there are additional organs, so if you did an SPK, you would now click the pancreas button, okay, and that would bring up the pancreas form where you'd enter details of the pancreas, for example. When you've completed, so you've filled out all of the organs and the donor information and everything's complete, click the green tick, and that's your transplant record completed. When we refresh, you will see that all of that information is now displayed in the patient record. So as you can see here, we can see the organ, the transplant date, how many days post-op we are. You can see the organ, the surgeon, some donor information here. You'll note that it's showing the CMV status for the donor. In a real patient, you'd also be seeing here the CMV status for the recipient. It's just that this test patient doesn't have any virology in the flow sheet. Same if you scroll down here, bit more donor information if you look at the extended information, and then you get your cold ischemic time, preservation type, number of arteries, donor and recipient side, and there'll be separate sections in here, for example, for a pancreas transplant, for a bowel transplant. If you were doing a kidney pancreas, you'd have a section for the pancreas cold ischemic time and anatomy as well. So that's the transplant record now complete. So the final task now is to turn what we've just entered into a formal operation note and fill out the rest of the details. And as we're all used to, the operation notes are found under the power note section in EPR. And what you'll find is we've now got some new templates available to us, which automatically pull the information that we've just entered into an operation note. So operation type will always be transplant operation. If we now search in here, under document template tab for transplant, you'll see that we've got preformed operation notes for kidney, SPK, pancreas alone, and dual kidney. So for this patient, we've done a kidney transplant, so we'll select that. We'll see that the title is correct, and we'll click OK. What happens next is it starts to identify that data that we've just entered to pre-populate our operation note, and you'll see that it's automatically selected all of that information to pull in for us, including all of the timings. If a patient has had more than one previous transplant, you may have to select the correct data for the transplant that you've just completed. If a patient's had no previous transplants, you can just select everything. So it just takes a little bit more time if you've had a previous transplant to select the correct data with the correct dates on for that transplant. When you click OK, up comes your operation note. You'll see the overview structure on the left-hand side here that we're familiar with. And as usual, you still have to enter the procedure code. So in this case, we'll put a cadaveric renal transplant in with today's date and time, add it to the patient's procedure history and click include. Okay, you can manually enter a description if you want to here. We can select the surgeon. Okay, and you can select multiple surgeons. So every time you select a surgeon, it'll pull up another box, so you can enter another one. If you want to add an assistant, you can do that. Okay. If you want to add your anaesthetist or multiple anaesthetists, you can do that. And again, if you've got another anaesthetist comes in halfway through the case, you just add multiple and they'll all appear on the operation note. Pre-op diagnosis, if you want to add that, you can select a formal diagnosis from the patient's medical record here, or you can free text the indication for transplant here. Okay. Pre-op dialysis status, say this patient was on HD, we just click that. You'll see these ones are all pre-populated. So transplant donor type is the deceased donor, DBD, preserved on ice. All of that information was filled in the transplant record form and that's pulled through automatically. Same with the cross-match information. So we don't have to do anything at all there. The operation note itself, you'll see that it's pulled all the basic information, so implant side, number of vessels and so on, and then we can just fill out the details in here. So no arterial reconstruction. This was a left kidney, so we wouldn't have elongated the vein. If there was a biopsy done on the back table, we can document that, and we can enter any comments as free text here. So whatever we want to put in here, and then we just click through. Each of these are just selectable. You can enter free text into the other sections. Say patient will be supine, we put a two-way catheter in, prep and drape as normal. We put the kidney to the right-hand side. Usual bits and pieces here in terms of preparation. Divided the epigastric vessels, preserved the round cord for this patient, let's say. Peritoneum's intact, cardiac vessels looked healthy. We've given heparin prior, and you just carry on and click your way through all the necessary information here. And if you do something slightly different to the norm, you just click other and you can enter it manually. So quality of reperfusion's already been populated because that was on our form. And if these don't apply, so if there was no bleeding, just leave it blank and it won't appear in your final operation note. True cut biopsy, bladder filled with betadine, aspirated with a needle, healthy bladder. If you want to enter a narrative, say if there's anything out of the ordinary that happened during the operation or you want to enter some specific details, you can enter in here. You see that's your narrative essentially. You can add a diagram for those of you that like drawing pictures. You can click on the diagram picture and actually manually draw, although it is a bit 1970s Microsoft Paint, so it's not that useful. Specimens, so you can have multiple specimens. So if you've got, for example, perfusion fluid, CNS, you can enter that in here, and then every time you click on something here, it'll pull up another line for you. So then if you've got your true cut biopsy or an iliac lymph node, you can add that in as well. And every time you add something, it'll just add another line. Once you're done, just leave the last line blank and it won't appear in your final operation note. So closure. You can document blood loss. Drains inserted, so whether you put drains in or not. And then if you've done any additional procedures, so if you've taken the peritoneal dialysis catheter out or if you've removed the tessio, you can document that here. Timings will automatically pull through. It looks a bit messy at the moment. The final operation note will look better than this, so just ignore the formatting, but your timings are all automatically there. And then if there's no complications or issues, you can select that. And then post-op instructions, so protocol immunosuppression, ultrasound timing in recovery, fluid management. We don't use TEDs generally, so we'll unselect that. Nutrition, eat and drink, and then any comments for post-op care. The other nice thing about these new operation note templates is that you can actually order things directly from the operation note. So you can come in here and you can actually order your perfusion fluid sample, the microbiology for your perfusion fluid sample, and you could order your ultrasound scan, for example, here. And the advantage of doing this is you can do this, you can place your order, and then when you close it, I'm not going to do it because this is a test patient, your orders will appear on the operation note. So it's really obvious to see that you have placed the orders. Unfortunately, the new operation note templates insist that you manually sign them. So I'll do that here. And then you can have a second signature if need be. And then once you're finished, you just sign and submit. Make sure the operation note type and the title are correct. And that will then have saved. And you'll see the final formatted note has all of that information that you've just put in and looks a little bit better than the template you were just looking at. So all of the detail that you've entered, both on the transplant record and manually, is all in here, relatively easily to read, including all of your timings and your post-op instructions. And that's it. That's the operation documented. That's all we need to do in theatre.